Bismillahirrahmanirrahim. Welcome to another session of Inferential Statistics. Inferential statistics is branch of statistics in which we draw inference and draw conclusion for population on the basis of sample information. To draw inference or to draw conclusion for population, we need to apply some statistical tests. In medical sciences, some common used parametric tests are one sample t-test, independent sample t-test, analysis of variance that is commonly used as ANOVA, paired sample t-test, repeated measurement ANOVA, and for categorical data, the most common used test is Chi-squaretest. Let's learn one by one in which situation these statistical tests can be applied. If your objective is to compare a standard value with the sampled data or with the collected data, or in short, if you want to compare mean of data with a given standard. For example, it is usually said the HB level during pregnancy should be 11.5. In this case, you will collect data of HB from pregnant females and you will compare it with 11.5. Or it is usually said the average weight of newborn is 2.5, that is normal weight. If you want to compare the weight of 100 babies or according to your sample size with the given standard that is 2.5 or 2500 grams, you need to apply one sample t-test. So one sample t-test, if all the assumptions are fulfilled, will be applied on a data in which the mean is being compared with the standard value. The common assumptions for one sample t-test are data should be continuous or at least on interval scale, or in simple, data must be quantitative. Data should follow normal distribution, and data should be taken at random. If you want to apply independent sample t-test, you need to compare mean of two independent groups. For example, if you want to compare HB level of HCV patients with normal population, remember the groups should be independent. They should not have any influence of one on another. HB level of HCV patient with normal population or healthy population, if you want to compare mean 1 and mean 2, you will apply independent sample t-test. The common assumptions are data should be quantitative. The variance of both groups should be statistically equal, that can be tested using Leibniz test. Data should follow normal distribution, that can be tested using one sample Kolmogorov-Smirnov test or Shapiro-Wilk test if you have sample size greater than 50. So these tests can help you to check the assumptions for independent sample t-test. If you want to compare more than two groups, previously we have learned, if we want to compare our sample data with mean of our sample data with given standard, we will apply one sample t-test. Mean of two independent groups, we will apply independent sample t-test. And if there are more than two groups, we will apply ANOVA, that is analysis of variance. If we want to test the effect of any medicine on quantitative data or responses, we will apply paired sample t-test when the observations are taken before and after the treatment. Or if we want to compare the means of paired data, we will apply paired sample t-test. The assumptions are mostly the same as we have already discussed, like data should be quantitative, should follow a normal distribution. If we have taken data more than 2 times, like at baseline, after treatment, after 5 minutes of the treatment, after 20 minutes of the treatment. For example, we are checking the blood pressure and we are taking the readings before treatment, after 5 minutes, or after 10 minutes. This kind of examples are usually applied for the people working in anesthesia department. Before intubation, at the time of intubation, after 5 minutes of intubation, or after 10 minutes of intubation or induction. When data is being collected repeatedly, we will apply repeated measurement ANOVA. So all these statistical tests that has certain assumption to be fulfilled, and if our objectives are related when what we have discussed, we can choose any of the statistical test. If you want to see the correlation between two quantitative data, we will apply Pearson correlation. And if one data is quantitative and other is ordinal, we will apply Spearman correlation. Or if both are ordinal or categorical, and if we want to measure the strength of relationship or correlation, we can apply Spearman correlation. If we want to see the relationship between one dependent and one independent or more than one independent variable, we can apply linear regression if our dependent variable is quantitative. If our dependent is not quantitative, it is categorical, we can go for logistic regression. If our dependent variable is categorical and have two options, we can apply binary logistic regression. And if there are more than two options of dependent variable, we can apply multinomial logistic regression. If the dependent variable is ranked, ordinal, or having grades, we can go for ordinal logistic regression. So for simple linear regression that we have just discussed, if there is one dependent and one independent variable, we can apply simple linear regression. And if there are more than one independent variable, we can go for multiple linear regression. There are certain assumptions to apply simple linear regression and logistic regression that I will cover in another session. If we want to see the association between two categorical variables or two categorical data, for example, infection rate according to two types of surgery. For example, just for understanding, if half of the patients are operated with open and half of with laparoscopic surgical procedure, and we want to see the status of infection or status of, for example, hematoma or another categorical response, we can apply Chi-squaretest. If you're using advanced softwares, or if you know the concept of expected count, if the expected count is less than 5, we can apply Fisher exact test instead of Chi-squaretest. Fisher exact test and Chi-squaretest are applied to see the association between two categorical data. The one major concept is, if we apply these tests, we always test null hypothesis, and for null hypothesis to be accepted or rejected, we set the cutoff value for p-value. Usual cutoff value is 0.5. If our p-value, 0.05. If our p-value is less than 0.05, we can reject our null hypothesis. Thank you very much for listening. Hope you have enjoyed. See you in another session.